Good evening. Thank you for joining me tonight. My name is Cherie Sims, and I'm going to be speaking for a few moments in regards to Quality Improvement Plan. A quality improvement plan identifies challenges in an organization and ensures that steps to overcome these challenges are put in place for better services. For instance, in our facility, the different units will be assessed starting from the emergency room to the customer physician referral. A QI plan refers to a detailed work plan for a healthcare organization. It usually consists of continuous and systematic actions which result in measurable improvement of services in a healthcare as well as the health status of the patient group in question. Quality improvement plans are used by healthcare facilities to implement change, thus ensuring better healthcare services. Our facility will use the QI plan to self-assess our performance in delivering quality care and identifying areas facing challenges and plan for future improvements. In assessment, all aspects will be under scrutiny such as hospital hygiene, availability of medication, condition of equipment in the hospital, compliance of staff to hospital guidelines, management and patient care, among others. The plan's initial objective will be to assess the conditions of the hospital in terms of availability of healthcare equipment. All patient beds and medical equipment should be in good shape. An inventory will be taken to establish which crucial items are not available. For instance, there should be an adequate supply of oxygen tanks in the intensive care unit. The ratio of patients to caregivers will also be analyzed to ensure that the available staff is not being overworked. The healthcare's information system will also be reviewed to ensure it is fully functional and effective. Any medical facility that is patient-centered usually has better patient outcomes. This is because the needs of the patient are attended to at the individual level, and thus while assessing, patients' views are crucial in determining areas that need change. Ratio of staff to patients' arrival is crucial in ensuring efficiency. If one nurse is allocated too many patients, he or she would not be able to attend all of them fully, and hence the need to review this aspect. To implement changes that are focused on the well-being of the changes, patients will be individually asked for feedback on the services being offered and what they would want changed or established. Clinicians will also be assessed to ensure they are exhibiting competency in their areas. Medical providers, salaried, will also be reviewed to ensure they are not being exploited. The Chaparral's Regional Hospital Management will also be studied to check whether they are providing a conducive environment for the hospital staff. Relationships between the patient and doctor will be assessed, especially in sectors such as the emergency room and rehabilitation. A good patient-doctor relationship has been known to significantly improve patients' outcomes. This is because it nurtures a trust between patients and medical practitioners, thus making the treatment process easier. Patients will also feel free to reveal certain information about their health that could influence the treatment process and result in great patient outcomes. It is crucial for a quality improvement plan to be reviewed annually so as to assess progress, as well as to know where changes need to take place. A better patient-doctor relationship will be implemented through ensuring caregivers personally follow up with the recovery of patients even after treatment. Better equipment will be purchased, for instance, convertible beds to give patients maximum comfort while receiving treatment. The management will establish strategies for motivating their staff, such as open forums to seminars. On assessment, patient flow in the hospital was more than the staff could handle and provides reason for additional hires based on budgetary needs. The Quality Improvement Plan will be put on review annually to ensure quality standards are maintained. In conclusion, a Quality Improvement Plan refers to an organized work plan meant to implement changes that promote better patient outcome. The Chaparral Regional Hospital should increase its staff to increase efficiency in patient services. Good patient-doctor relationships is essential for better patient outcome and hence should be cultivated. Proper medical equipment should be availed to improve quality standards. And lastly, the general condition of the hospital should be improved, for instance, better hygiene standards, thus creating a conducive working and recovery environment for the staff and patients respectively.